Welcome, Angela. I'm thankful for you for accepting the interview and going forward with a 15 between discussion on physical therapy, especially when it comes to pelvic pain. So why don't you get us started and let us know a little bit about yourself, specifically the last 18 years when you practice hands-on with your patients.
Sure. Yeah, I've been a therapist for over 30 years, but really the past 18 years, I've been involved in pelvic floor health. And initially, I was going to start with just incontinence. So I had extra training and I thought, okay, I'm all ready. I'm going to see patients with incontinence. And the first person that walked in the door to see me for incontinence actually had very severe pelvic pain. And within like 5 minutes of interviewing her, I knew I was in over my head. I thought, okay, this is a different thing. I don't understand because pelvic pain is kind of a whole different beast in and of itself. It's different than what I was expecting with incontinence. So I really then went back, took a lot of training, really got a much better understanding of pelvic pain, got a mentor, and I was lucky enough to work in a hospital where we had urogynecologists who very regularly referred us patients that were suffering from different pelvic pain syndromes. So I got to see firsthand really how effective it can be when you start addressing some of the muscle tension and musculoskeletal problems that come along with pelvic pain. Very different than someone who, for instance, is weak and having leakage issues or prolapse issues. So that's really how I got started. And because it was so effective and really can help change a woman's life or a man's life, because we also saw men as well, because men do have pelvic floors and have very similar issues that come up.
Yeah,
Um,
that was actually going to be one of my questions because I never thought of a man as having like pelvic floor concerns or issues. So can you
yeah,
touch on that a little bit as in terms of what are some of those concerns that men may have experienced when it comes to pelvic floor issues?
sure. Yeah, their anatomy is very similar as far as having pelvic floors. Obviously, they don't have three openings; they've got the two openings, and so anytime there's pelvic floor tension, you can potentially see problems in any of those two areas in men and three areas in women. And so men with pelvic pain also often show with genital pain, groin pain. A lot of times their abdominals get involved as well. It can exacerbate back pain, but there's a lot of, just like in women, there's a lot of different presentations of pelvic pain. Men have the same types of issues, and they don't have the benefit of being identified as often as in women. And when I say often, as you know from your experience, it's not, it really takes some digging and finding the right healthcare practitioners that understand the increased pelvic floor and pelvic area tension issues to get you the right help. So men are
Yeah.
usually further behind than women are, unfortunately. But
Yeah, and you're absolutely right. And the reason why I chose to go forward with having a discussion on physical therapy is because um, when I started off on my journey and trying to figure out what was wrong with me in terms of painful sex and just um, I didn't know exactly where to go. And when I was referred to a physical therapist, and my doctor had said to me that this person would be involved with stretching my vaginal muscles, I didn't know exactly what that involved, and I recently posted a link to my a story on my page, kind of talking about my whole experience about that. And I was talking to a friend about it, and she said she had never heard of anything like that. So I thought, well, this is a really good topic to bring forth to talk about, to not only share my experience, but maybe answer some questions that other people may have, and so forth. So
well, and sometimes when you tell people they're going to stretch your vaginal muscles or vagina, that's very intimidating.
yeah,
So we like to kind of
exactly.
use different wording. Like we explain, there's pelvic floor muscles, just like you might have a tight muscle in your shoulder, and
Hmm.
you work those tender points out. The pelvic floor muscles are made of skeletal muscle, which is the same type of muscle in your arms and legs. So if you have a tight, like a trigger point in, let's say you get a sore neck and you've got this point where you touch it and it really bothers your neck, you work those muscles out. So really pelvic floor therapy is about doing that same thing with those areas of tension. They're just in your pelvic floor. So the type of therapy is a little bit different, but the idea at the base of it is the same.
Gotcha. Okay. All right. So with that, let's just kind of jump into the demo because I see you have a friend there
Yeah,
behind
so
you.
I like to keep the spine not just the pelvis, but an actual spine when I treat my patients, because when we treat for pelvic floor therapy, it's not just the pelvic floor. So the pelvic floor is attached to the rest of our body. So I really like to use the whole spine to kind of explain to patients what we're working on. Just briefly, pelvic floor muscles are what cover the entire bottom of the pelvis. So they run from the pubic bone in the front, tailbone at the back, and then these sit bones, the bones that you feel when you sit, they attach there as well. So the entire bottom is covered with pelvic floor muscles. And then they surround our 3 openings in a woman. So around the urethra, vagina, and anus. That is why you can see problems in any or all of those areas if you have a pelvic floor muscle problem. But then we got to look at, what about our spine? What's our posture like? Excuse me. Is somebody having a lot of pain and forward a lot because they have so much pelvic pain and they're kind of in this fetal position? That has a lot of impact on the position of our pelvis. We should have the pubic bone kind of underneath our pelvic organs for support. But if we're all tight and pulled forward, now that great big opening is straight up and down and doesn't have that nice support of the pubic bone that it should. Okay, so if you're holding in pain forward, that can impact how your pelvic floor muscles are actually working. And if you are in that position, then what's going on with the back muscles? What's going on with the abdominals? What's going on with the hip muscles? Because there's hip muscles that come in and actually attach into the pelvic floor. So they very directly impact what's going on with those muscles. So we really need to treat very holistically when we treat somebody with pelvic pain. It's not just, come on, let me figure out how to get those trigger points in your pelvic floor better. We also have to look at your breathing. We need to look at your abdominals. We need to look at your spinal position and pelvic position and stretch what's tight, help you learn how to relax what's tight, help strengthen what might be weak. Because a lot of times when you're tight and like over tense in one area, there might be some weakness in another. So it's really about rebalancing the entire area.
And what typically causes issues with pelvic floors, with your pelvic floor muscles in terms of it being painful or tightening or what have you? What do you
So
know
it could
what
be
that
very chicken and the egg type thing.
chicken and
So
egg? Gotcha.
you could easily have, maybe you have a painful birth where you have, or a birth that you have a painful incision. So after you either tear or they have to do an episiotomy, now maybe your scar is tender. And when you sit, you have pain. When you have intercourse, you have pain. And now that pain starts to, if it doesn't go away right away, it can kind of snowball into this whole pain pattern. Okay, so you have things that could like actually impact or injure your pelvic floor that could then cause this pain pattern. But it could happen the other way as well. Maybe you have GI issues and you kind of tense and hold because your stomach's not feeling well. Or maybe you, just like some people clench their jaw muscles when they're tense, some people clench their pelvic floor. So it could start from a myriad of reasons. It could be an injury or assault to the pelvic floor, or it could just be this tension pattern that's part of a larger thing or from a different cause that then overflows to your pelvic floor and you start seeing pelvic floor symptoms such as pain with intercourse, bladder urgency or frequency,
Gotcha.
constipation often goes along with that, things like that.
Um, how does that work in terms of the actual therapy part of it? I mean, because I'm thinking of a woman as being elastic, and then once you stretch, it kind of goes back to the original position. So how does it actually work in terms of going to a session and seeing a physical therapist, and then the therapist goes in and does the actual work that goes behind it? Yeah.
Yeah, so I like to kind of explain it more like, instead of just stretching, it's building flexibility into the system. So you're working out those tight, tender, real specific trigger points that you find, but you're also just making that tissue more extensible, because you're exactly right. It should be elastic enough to come back together. Some people, when they hear, oh, they're coming for pelvic floor therapy, they're worried, oh, they're going to be overstretched. And that's just not how the tissue works.
Gotcha.
It's kind of, if you think of tight hamstrings, right? I can't reach the floor when I bend over, but as you work on stretching those hamstrings over time, now I can bend over without all that tension. but it doesn't mean I have to function all day long bent over. I can also come right back up and my hamstrings pull back together. So it's really about decreasing the pain and getting rid of those trigger points and building flexibility in that actual tissue. So some of that, we do that through manual therapy, which just means inserting a finger, sometimes two fingers, to directly work on those pelvic floor muscles.
Okay.
And then a lot of times we also will issue a patient something called dilators. And dilators are something you insert into the vagina, and they come in graduated sizes. So the smallest size is we try and start with a size that's very non-intimidating and non-painful, so
Gotcha.
that because it's very important to teach that the vagina can have something inserted without pain. As once you've had pain there, especially pain with intercourse, anytime you come anywhere near the fact that you might have intercourse, your whole body goes like this. And it's
Yeah.
very subconscious. It's not a conscious thing you're doing. It does not help for your doctor to say, just have a glass of wine and relax. That is not what we're talking about, because that does not work.
I'm
It's
actually glad you're saying this. Very, very glad you're saying this.
I can't tell you how many women have come to tell me, well, I just tried to relax more and it doesn't work. That's because it's a whole psychological overlay, because there's been pain here. If you knock your head on the wall, you're not going to do it more than once because it hurts.
Yeah.
So something with intercourse, most women are trying to, if they're in a relationship, trying to continue as best they can to meet the needs of that relationship. So they often put themselves in a position where they know something's going to hurt. So you have this pattern of, oh my gosh, those muscles are going to pull. And then, of course, it does hurt more because now those muscles are in that tense position. So the dilators kind of help unwind and get that pattern reversed, so that you can teach your body that it's okay for something to be there and you won't have pain. So it's really kind of rebuilding your trust in the tissue as you're building that extensibility back into the muscles.
Gotcha. And these are exercises that a woman can typically do on her own. I mean, once
Right.
she's had her sessions and then
Yep.
okay.
Yep, there's usually a manual therapy component while we're with you, and we're going to teach. There's a lot of education and teaching about this area of the body, because most of us just want the pain to go away. We don't really like dive in and really understand what's going on. And so that educational component is really important to understand, why does it hurt? Why, what's wrong? You know, a lot of women will think, what's wrong with me that I can't have intercourse? It hurts. That's not supposed to be that way. There's something wrong with me. And that's just not true. So we do a lot of education to just explain, and with the partners too, honestly, we'll often have partners come into therapy as well, so that they understand, because often the partner will think, well, maybe she just doesn't like me, or there's something wrong with the relationship, or what's wrong with me, and all of a sudden becomes about them, even though you're the one hurting. So
Yeah.
a lot of
Absolutely.
layers that can really happen when you have pain with intercourse.
Okay. And so when a patient first comes to see you, is that something that you start off with, just the education component of it, or do you kind of stop them right there even before they make the appointment and say, you know, maybe if they are in a relationship, to invite their partner first, or do you like to have conversations with the woman first, or how do you typically approach
Yeah,
that?
definitely just the woman first, because
Okay.
like I said, there's a lot to learn. The first appointment is very talky. There's a lot of talking going on. Fill me in on what's going on. What's happened in your past? You know, the rate of assault in America is higher than we would all like it to be. So women that have been through an assault or a traumatic experience are going to have higher levels of pelvic pain and pelvic floor muscle tension. So you need to build trust with a woman and make sure that they know that you understand what's going on with the muscles, and be able to have this feeling of trust that, hey, we're going to teach you ways that you can feel more empowered about what's going on with you. So there's a lot of that trust building before we then invite the partner in. We really want to make sure from the woman's standpoint, we're understanding, okay, what are you going through? And then here's what I can tell you about why this might be hurting. Here's our plan of what we're going to be doing. And then after maybe 2, 3, 4 sessions and things are starting to improve, let's bring your partner in so that he or she can understand now what's going on, so that you guys can be more of a team.
Okay. And so with your success stories, how long does it typically take for a woman to see progress? I know you say after maybe 2 to 3 sessions, once you see improvement, then you maybe bring a partner in, but typically how long does it take for a woman to really see those lasting effects?
Yeah, this varies greatly by women depending on what's going on.
Okay.
So if it's something that's more simple, let's say somebody has had a baby, has pain with intercourse following giving birth because of scar issues.
Hmm.
That's a fresh scar. That's something that we can probably pretty quickly help resolve.
Okay.
But if it is somebody who's had pelvic pain for 5 years and they also have tailbone pain and they have a history of sexual abuse and they just had hip surgery because the hip is so important for the pelvic floor. Well, now we're talking, there's many more sessions that we're probably going to need to do to kind of unravel all of this. So I tell people 6 is probably the very minimum for more of the simple things. 6 to 12 is probably in the ballpark, but I've seen people for up to 6 months even. The very far outliers, even longer than that. It really just depends on what's going on with the woman. So, but you should be seeing improvements all along. It's
Gotcha.
not like you'd come for therapy for 6 months and not see any improvement and think, well, 7 months is going to help. If it's not helping within 6 weeks is kind of our kind of guideline of if nothing is helping and we've tried different things that we think should help and it's just you're just not responding the way we need to, well then it's time to get the physician or other healthcare provider wrapped back in and see why are
Gotcha.
we not progressing the way we think we should.
Gotcha. And of course that's a combination of the sessions that they're seeing with the therapist in person and what they're doing on their own, correct?
Right. So what they do at home is very important as well. Yes.
Gotcha. Okay. All right. So, Angela, can you let us know what you're doing now? Because I know on your site you mentioned that you've kind of transitioned over to telehealth. So I'm just curious as to what caused that transition and what services you offer now.
I did. Before the pandemic, actually in 2019, my husband and I were realizing we were soon going to have our last child going off to college, and we wanted to be able to travel. So I wanted to still practice in this area, but have a chance to be able to be gone for extended periods of time. So I thought, telehealth, that's a thing.
Oh, wow.
Everybody knows it's a thing now, but back then in 2019, not that long ago, it was kind of a new thing. So I kind of had that plan in my mind. And then of course,
so you were ready. Yeah.
So yeah, I was ready to go. My last day was March 5th from work. So yeah, it was right before all this happened. So pelvic pain, because there's such a hands-on component, I really don't see as much pelvic pain as now. I mean, my entire career, I treated that quite heavily, but that's not something, there's components of it that you can do because there's so much education through telehealth, but the patients that I've had since I've started my business last year, I've paired with somebody who's also seeing these people in person, because you really need some manual therapy. And in-person care for those more complex issues. So right now I really focus more on any kind of bladder symptoms, whether it's frequency, urgency, leakage, getting up at night, any kind of bladder discomfort like that. Postpartum women do really, really well. A lot of them have problems with abdominal weakness, or they worry about diastasis. Their pelvic floor needs retraining. They want to get back to running, all of those things. Really easy to treat through telehealth. So those are kind of the things I've been focusing on.
Okay. Well, I'm glad to hear that. So, and what states do you currently practice in? I'm just curious. So
so you still need to be licensed in every state. There's not a national license. So I'm licensed in Illinois, California, Florida, and New Jersey.
Okay.
So
all right. Good to know.
Whoever I'm seeing needs to be in those states physically. So
gotcha. Good to know. Okay. Well, Angela, thank you so much. I really appreciate you taking the time, and I will post your information when I release the video so everyone can see how to reach out to you should they have any questions and would like to follow up further.
Absolutely. Well, thanks so much for inviting me. I enjoyed it. It's really nice to meet you.
Okay. Nice to meet you too as well.